So hi, I'm Jake Gillberg. I'm humbled to be here today to help organize the Health Equity Workgroup and give this update. I just want to say that there's a lot of folks who have been taking the lead on a lot of work that's been happening in this workgroup, and some of that will come up as we go through the updates today. And I also want this presentation to be an invitation. There's plenty of room for leadership, organization, and participation in the work that we're looking to do. It's quite an ambitious working group. So the Health Equity Work Group is relatively new. It was formed 3 months ago as a response to Patrick's mid-year OKR review that reported we had made zero progress as an Odyssey community on objectives related to health equity. It's sort of hit the ground running. We have 128 members. We meet every other Tuesday. There's a lot of stuff going on that I'm excited to share with you. I think it's important to acknowledge that health equity has been getting a lot of attention lately, and that this hasn't always been the case, and that like any new field with an influx of researchers and participants, there is potential to sort of not be building on large amount of work that has been done before, and that especially in this area of health equity, we want to be careful that the work that we're doing isn't, leading to misinterpretations that generate or reinforce stigmas. So there's a sort of statement by the work group up there at the top, and a reference if you want to read more about some of those issues. I also have a little diagram here that sort of gives maybe an impression of all of the activities that the working group is looking to do. Just really, I want this to sort of show that I think that health equity can really be central to the mission and vision of Odyssey, and shouldn't be thought of as constrained to one specific working group, but as a perspective that can be brought to many working groups, and an objective for us all to be reaching for in all of the work that we do. So 3 weeks after we formed as a working group, had our first meeting, the Aim Ahead Research and Coordinating Center research funding opportunity was announced. Aim Ahead stands for AI and Machine Learning Consortium to advance health equity and researcher diversity. This was a $100 million opportunity split across 4 separate cores, and the Health Equity Working Group decided to apply for the Data and Research Core application under the leadership of the PIs Arash Shabanjad from UTHSC and Noemi Eladad from Columbia. So this was 3 weeks of intense collaboration from announcement to application due. We had 45 individuals participating, 15 different institutions represented, 28 letters of support from some awesome community organizations were included in there as well. We did not end up getting funded, and I think this portion of the award went to OCHIN, but that's totally okay. I think this was a really awesome opportunity to sort of hit the ground running, get a lot of input from a lot of folks on what work they were interested in. It formed a large basis for our objectives and key results, and I think was largely a success. And I'd like to see more efforts like this in the future. One reflection from Aim Ahead that I have, I think, and one thing that I was really excited for in the Aim Ahead application that I don't think is really reflected in our objectives and key results of the Health Equity Working Group is this idea that even though Odyssey tools are free, it takes time and money to participate, to learn, to ETL data, and I just want to leave it as an open-ended question: how might we be able to, as a community, direct resources to supporting a diversity of researchers, community partners, and data involved in Odyssey research and development? So if you have thoughts, please let me know. Okay, so getting into our objectives and key results, I have given things numbers and colors. These numbers and colors have not been peer-reviewed, so please take them with a grain of salt. But the main thing that I want you to get out of this is that is that, we're in our first quarter of being a working group here. If things are in the blue or the green, if we sort of have momentum and leadership right now, and if we maintain that momentum, we're on track to complete our objectives. If we have a yellow, it means we need more help. Either there are some leaders and some work being done, but there's more folks that need to participate for us to meet our objectives, or there's more leaders that we need to help with that objective. The orange is maybe some work has been done, but we do not have a leader identified that's really carrying it forward. And then the red means that we haven't done anything in that area yet. So keep that in mind as we go through these, where you might be able to jump in and help out. So our first objective is to generate and disseminate real-world evidence about the substantial public health issue of health inequities. Right now we have HERA, a large-scale health equity research assessment that's being PI'd by Noemi El-Haddad, and that just received a refresh in protocol and analysis. We're looking for data partners who, especially in the US, who have data for the year 2017. And that's just sort of one study. We need other studies and analyses of the HERA data to turn into papers and presentations and all that. Especially of interest is if you have think of a way that study results could be turned into external decisions by external or internal stakeholders. That's an area where we need help. The next is standards for studying patient-level social determinants of health, risk factors, and needs. I think there's a reference there for why those aren't all the same things, and the distinction between determinants, risk factors, and needs. That you should maybe check out if you're interested. But this is really the idea of getting data from survey tools or screening tools or patient-reported values on things like sexual orientation, gender identity, on housing insecurity, that sort of stuff, from patient records into the CDM for research. So the use cases or the objectives in this area are really, finding those vocabulary elements to map that data, use that data in studies, maybe work with the NLP team to use the tools that they're developing to extract SDRN, social determinants, risk factors, and needs. So the next is standards for studying community-level social determinants, risks, and needs. This is mainly in collaboration with the GIS working group. If you're interested in this is what our call in the Health Equity Work Group is going to be on today. We have 4, I think, or 3 different presentations from folks who are looking at using external GIS data sets, attributes about a place, population density, average income, that sort of thing, to attach it back to OMOP data. And yeah, we're looking to use the GIS tools to do a network study that includes those data sets. What we are still looking for is a priority use case for rolling up patient-level OMOP data to describe spatial population-level properties. So this is the idea of maybe we can, using OMOP data alone, see the different disease burden of a particular disease in different geographies, instead of going the other way and taking data about geographies and attaching them to patient records. Okay, and another objective is to extend Odyssey tools to make health equity perspective the default and/or an option. Ross Williams has been doing some awesome work with patient-level prediction to expose the differences in prediction, predictive power, and other fairness metrics with the prediction models it creates. And there's still some work to be done there, and if you're interested, please reach out to Ross. And Juan Banda actually had a really great presentation about some of this as well in the symposium, so you can check out that lightning talk. The other things that we're looking to do is release a tool to assess data quality and gaps for some of the data that we're looking to collect at the patient level, and then also developing a framework or best practices in health equity across study design. Another objective of ours is to engage the broader community on issues related to health equity. There is a really awesome journal club that just started last month that's going to meet monthly. Brianne Oliveri-Mui started that. And yeah, some really great stuff there. So I'd encourage you to check that out. That's in addition to our bi-weekly meetings. We want to sort of engage the education working group and early stage working groups, to have a health equity perspective in some of the educational materials that we release, and really to support researcher diversity and researchers who are young in their career. And then an objective that was sort of a gimme that we gave ourselves here was applying for a grant, because that wasn't sort of initially what we thought we might do, but we did it and it was awesome. Okay, so next steps. If you're interested, there's another study going on, which I forgot to mention earlier, in sort of collaboration with some folks from the oncology working group, REMA, and that's looking to assess racial disparities in cancer surgery. All of these folks, are early on in the work and could use partners, so feel free to reach out to them. Our upcoming meetings today, we talked about that meeting. 10:15, our journal club is going to be reconsidering race correction in clinical algorithms. 10:19, our meeting is going to be on predictive algorithms and health equity. 11:2 is going to be the patient level SDRN data elements and standards. And yeah, please reach out if you have any feedback or anything that you'd like to lead. Thanks.